Welcome to Tuesday's edition of COVID-19. We are marking a second day of daily infections on the 300 level as we count down to the launch of our own inoculation this coming Friday. And speaking of that, we have more coverage on the upcoming vaccination campaign later on the program. But first, here is our Kwon So-ah with the pandemic updates. Now, So-ah, more tests were conducted yesterday and the daily tally has risen slightly.
Right, Sun. It's not a dramatic change from Monday. We are now in the mid 300s, an increase from the low 300s, 357 to be exact. And also both domestic and imported cases have risen slightly from yesterday. Now, when we take a look at the daily developments in the past, we do see a pattern where the numbers have been increasing around the middle of the week. So we might see a rise by tomorrow, and that on the back of more tests being conducted on work days. Now, if we go over to the details, the total number of infections in Korea stands at 87,681, and we have a total death toll of 1,573, with 11 people having lost their lives in the past day. And if we go over to our map, we are seeing an increase in the capital Seoul, which has a similar number of cases today as Gyeonggi-do province, and 14 cases in Incheon and Gangwon-do province, and also double digits in the southeast of the region. And also here, Ulsan, although just 2 infections reported in the past day, this city now has a total of over 1,000 accumulated infections. Now, while it's been now over a week now since social distancing measures have been eased by a notch, the government is expected to unveil a revision to the current social distancing scheme as early as before the weekend. Officials note, though, there's been a number of businesses that have been ignoring basic prevention rules, such as nightlife establishments. They were not keeping entry locks, and some of the visitors were not wearing face masks. So Prime Minister Chung Se-kyun issued a strong warning.
방역수칙 위반 업소에 대해서는
A one-strike rule will apply to businesses that violate antivirus measures, and they'll be penalized without exception. They'll also become ineligible for the fourth round of emergency relief funds that will soon be handed out.
Right, some tough words there. Meanwhile, on the international front, so there has been some positive news with regard to the efficacy of vaccines from AstraZeneca and Pfizer.
That's right, Sunny. According to a preliminary study in Scotland, 4 weeks after receiving the first dose, both the Pfizer and AstraZeneca vaccines have reduced hospitalizations by 85% and 94% respectively. And hospitalizations among people aged 80 and above were also reduced by a combined 81%. And that is a positive development, including here in Korea, because those 2 vaccines will be one of the first to be administered here in the country, and we will have more on the domestic vaccine process with our Kim Jae-hee in a bit. But before that, let's take a look at the figures around the world. With the vaccination process in full swing, the UK, currently at 4.1 million infections, is getting ready for lockdowns to be eased, while over in France at 3.6 million cases, the number of daily cases is on the decline there, but in France's Nice, there's been a surge in cases, so another stronger lockdown is now in effect there. And also Germany is struggling with variants. The proportion of variants is at around 50% now. And we also have here Indonesia with some 10,000 new infections, having surpassed the total amount of cases in Peru. And with that, the global figure now stands at 112.2 million infections, with a similar rise compared to yesterday. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
Right, so thank you for that. Right, back on the domestic front, as mentioned earlier, we have more coverage now on our inoculation drive that is slated for this coming Friday. As So mentioned, I have Kim Jae-hee here in the studio with me. Welcome, Jae.
Good afternoon, Sunny.
Right, Jae, do start us off with the logistics of the operation.
Right, the transportation process of the vaccination will officially begin on Wednesday, tomorrow that is. Over a 5-day period starting Wednesday, locally produced AstraZeneca vaccines will be shipped out from the SK Bioscience vaccine plant in Andong, Gyeongsang-buk-do province. The vaccines, enough for 750,000 people, will be shipped to a logistics center in Icheon, south of Seoul. And from Thursday, they will be distributed to public health centers and nursing hospitals across the nation. Vaccine injections will begin this Friday at 9 a.m. to be exact for patients and workers under the age 65 at nursing hospitals and other care facilities. Now, also on Friday, Korea will bring in 117,000 doses of the Pfizer vaccine, enough for over 58,000 people, provided by the COVAX facility. Inoculations of the Pfizer vaccine will begin Saturday for 55,000 frontline medical workers treating COVID-19 patients. Vaccinations for other COVID-19 first responders, such as paramedics and disease control personnel, will begin later in March. Now, Pfizer's vaccine have not been approved by the nation's drug regulator as of yet. Later today, health authorities will announce the results of their first advisory meeting on the Pfizer vaccine, which was convened yesterday. It was the first of 3 meetings required for the approval of the vaccine, which the Food and Drug Safety Ministry is pushing to finalize by the first week of March.
Right, by the first week of March then. Now, in the meantime, I hear related officials are going all out to ensure an efficient vaccine rollout, Jay.
Well, Sunny, this is a pan-governmental undertaking and all hands are on deck, with authorities sparing no effort to ensure smooth launch of the vaccination program. The Defense Ministry on Monday reviewed preparations for the transport of vaccines. The ministry had already carried out a second and final mock drill for the planned transport last Friday. The National Police Agency said Monday that the police will mobilize all possible resources to provide and secure the details of transport and storage of vaccines. The Korea Disease Control and Prevention Agency also reassured the public that medical workers administering the vaccines will be trained fully to their highest level.
Nursing hospitals and medical centers that are administering the vaccines must complete their advanced training. To ensure safe vaccinations, regional governments will conduct a prior inspection of designated medical centers. Vaccine registrations will also be available starting on February 25th.
Right, that is good to know. I also hear quite a number of people, Jay, within the first group to be inoculated are in favor of the campaign.
That's right, Sunny. A recent survey shows that 93.8% of all individuals in Phase 1 priority groups have agreed to be vaccinated. More than 92% of people in nursing hospitals and some 95% of those in other healthcare facilities have agreed to receive AstraZeneca's vaccine. Also, over 94% of medical workers at COVID-19 treatment hospitals gave their consent to Pfizer shots, bringing the overall total to 93.8%.
Right. Jay, before you go, one final question. How are authorities here seeking to ease possible public concerns over vaccine side effects?
Well, health authorities here in the nation have reassured the public many times that the vaccines are safe and they're fully prepared to respond if any side effects do occur. Let's take a listen to what the government said yesterday.
이미 기관별 역할, 대응 절차,
We have given detailed instructions and guidelines to relevant bodies on how they should respond to any situation. We have also set up emergency task force in all 17 cities and provinces across the country to quickly investigate any possible links between the vaccines and adverse reactions should they occur.
The government added that the COVID-19 vaccines have demonstrated their efficacy through their rollout in other countries, and the side effects reported thus far were mostly mild.
All right, that is comforting to know. Okay, Jay, thank you very much for the coverage.
Thank you for having me.
Right, staying on the local front, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Tuesday. Authorities are looking to revamp their guidelines on COVID-19 prevention after taking into account this week's daily numbers. Meanwhile, the current social restrictions will be in effect until this coming Sunday. The Greater Seoul area faces level 2 social distancing guidelines, while the rest of the country is under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members only, including grandparents, parents and children. And a few businesses, including movie theaters, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. But all nightlife entertainment establishments, including bars, can only accommodate patrons until 10 in the evening. Also, movie theatres and performance halls are being asked to leave one seat empty between patrons or parties. Sports stadiums here in the Greater Seoul area can host 10% of their capacity, while those elsewhere can host 30%. The briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 23rd. As of today midnight, we have a total of 330 new local infections and 27 new imported cases. With that, the total caseload now stands at 87,681. And currently, 7,714 people still remain in quarantine, and there are 148 patients with critical or severe conditions, up by 2 from the day before, and we had 11 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us go over our major updates of domestic infections. We have 330 new local infections, and by region, 252 in the capital area and 78 in the non-capital area, 13 in Chungcheong, 19 in Honam area, 14 in Gyeongbuk province, and 18 in Gyeongbuk province, and 14 in Gangwon-do province, and we had 0 cases in Jeju Island. And by region, here are some major details. First of all, in the capital area, in Seoul's Mapogu district, in relation to an office, we have also identified the first index case on the 15th, and we have 13 additional cases, increasing the total to 14. And in Seoul's Yongsan-gu District University Hospital, we have 9 additional cases being confirmed, and in total, we have 227 cases being confirmed to date. And in Gyeonggi-do Province, Namyangju City, in relation to the plastic factory, we had 8 additional cases being confirmed, and a total of 179 cases have been confirmed to date. And in Gyeonggi-do Province, Seongnam City, in relation to a ballroom dancing, we have 6 additional cases being confirmed, and in total, we have 62 cases being confirmed to date. And in Gyeonggi-do Province, Seongnam City, in relation to a nursing hospital, we have 5 additional patients, and the total now stands at 60. And in Gyeonggi-do Province, Yongin City, in relation to an athlete and fitness center, we have 15 additional cases being confirmed, and we have 43 cases being confirmed to date. And in Chungcheong area, in Chungcheongnam-do Province, Asan City, in relation to a boiler factory, we have 1 additional cases being confirmed. In total, we have 173 cases being confirmed to date. And in Chungbuk Province, in relation to a university in Yeongdong-gun County, we have 3 additional cases being confirmed, raising the total to 13. And moving on to Honam Province, in Gyeongbuk Anju City, in relation to a factory, automobile factory, we have a total of 24 cases being confirmed. And in Jeonnam Muan-gun District, in relation to a family gathering, we have 5 additional cases, raising the total to 19. And moving on to Gyeongsangbuk-do Province, in relation to a family gathering and a hot spring in Uiseong-gun County, we have 5 additional cases being confirmed. In total, we have 67 cases being confirmed to date. And in Gyeongnam area, in Busan Yeongdo-gu District, in relation to a hospital, we have 5 additional cases being confirmed. In total, we have 16 cases being confirmed to date. And in Gyeongnam, Gyeonggi Province, we have the family gathering. We have 6 additional patients being confirmed, and a total of 7 have been confirmed to date. And moving on to Gangwon-do Province, in Jeongseon-gun County, in relation to a church, we have 2 additional cases, raising the total to 22. And lately, we are also seeing cluster infections stemming from industrial complexes. During the past 2 weeks, we have seen 14 cluster infections at office buildings, including these assembly lines, and we have 513 people being infected so far. And in Chungnam, Asan City, in relation to the boiler factory, we also have a major cluster infection. And also one is the Gyeonggi-do province, Namyangju City's plastic factory, which has infected more than 179 people, and 120 of them were foreign workers, and 10 were also family members. And we also have 46 additional contacts who have been confirmed. And also we have the 173 people being confirmed at the boiler factory, and among them 26 were foreign workers. And we also have additional transmissions to many people as well. And our epidemiological investigation shows that the following were some risk factors. First of all, they were prone to the virus infections because they also had dormitories. And second, they had closed environment, crowded environment as well. And they also had poor ventilation. And third, they also did not wear the face mask properly. So to this end, the quarantine authorities would like to highlight the measures to prevent a further spread of the virus at similar facilities. We are also cooperating with the Ministry of Justice and Labor, as well as the local governments, and we are also carrying out mass testings as well. And we need to also make sure that anyone should also have the access to these testing centers, regardless of their status here in South Korea. And this is all about increasing the accessibility to these COVID-19 tests. So all of the foreign workers who are residing here in South Korea, they need to also realize that they can get tested without any discriminations. And we believe that this ultimately is the goal to protect the lives of our public. And we will be moving into a March very soon, and we only have 1 week left until we have the new school year for our schoolers. We have many people of the first graders of primary school, and there are also many parents who will be longing for the resumption of offline classes. And we also believe that the students must be very much looking forward to their new school year. And the quarantine authorities are exerting our full efforts to cooperate with the Education Ministry in order to secure and enable a safe environment for these students going forward. And during these new school year, we believe that the following antivirus measures need to be abided by at schools. First, starting from today, which is 1 week before the beginning of the new school year, we ask you to monitor your situations and health conditions, and please upload your information on the application. And if you have any suspicious symptoms, do not go to school and get tested as soon as possible. And third, when you are at school, we ask all of the students to also wear face masks and also comply with the quarantine measures as well. And we are also seeing a global rise in the number of new variants being identified, and we have also announced earlier on the 19th of February that starting from tomorrow, we will be compulsory having all of the foreign entrants to submit the PCR negative documents. This will be mandatory not only for foreigners, but also for Korean nationals as well. And we believe that these they have to, if there is a breach, they will also be incurred with a large cost as well. And so we ask for you to comply with these measures going forward as well. And we are also seeing continued persistence of high risks of the infections here in the local community. And we are also have relatively high risk factors. Nevertheless, we have agreed to expand the offline classes for our students in order to enable the education choices and the rights to education for our schoolers here in South Korea. In order to enable them to have a safe school year, we ask all of you to continue to comply with these measures wherever you are, and we believe that cooperation of all of our circles are very important. We believe that at schools, the antivirus measures are abided by relatively well. However, these need to be also guided at the cram schools, private education facilities, and especially as for the faculty members and teachers, we ask you to take particular precautions and practice good hygiene as well as social distancing measures. And all families, we ask you to also monitor your health conditions starting from today, and please monitor your conditions very closely. And if you have any clinical symptoms, please get tested as soon as possible. The quarantine authorities would also like to take particular precautions in relation to any areas that are related to our students' education. Above all, it is very important if you have any symptoms like coughing or fever that you need to get tested as soon as possible. You need to see whether you have been infected with the COVID-19, and you also need to recover from the virus if you have been infected already. Moreover, under such situation and circumstance, we believe that complying with personal hygiene measures is very important going forward as well. And the quarantine authorities would like to also note that with the vaccine rollout, which is slated to begin this week, until we have a stable control of the COVID-19, we will exert all-out efforts to provide a safe and healthy environment for our people. Despite the high level of fatigue, we ask you to comply with the measures going forward for the time being. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖도록 하겠습니다. 먼저 사전에 출입 기자.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. So what did he have to say?
He had some important messages or guidelines before the new school year begins soon. He mentioned that students and faculty should monitor their health conditions before they return to school, and also always wear face masks while they're at these schools. And also, as there have been numerous infections linked to industrial complexes, which have been found to be places of sources of the virus due to a number of risk factors, he mentioned that those are due to a lot of dormitories at such factories, confined and crowded places, poor ventilation, and not properly wearing face masks. And also, there have been a high proportion of foreigners at such factories that have been infected with COVID-19. So he stressed that foreign workers here in Korea must be reminded that anyone can be tested for the virus without discrimination. And just a few updates on the numbers of those factory cases. At a boiler factory in Chungcheongbuk-do province, a total of 173 cases have been confirmed as of today. And in Gyeonggi-do province, at a plastic factory, also 179 infections with 8 new cases.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Now, prevention remains a priority, and that is why authorities are deploying mobile COVID-19 testing units as part of proactive efforts to curb the spread of the pandemic here in the country. To take a look.
Korea is reporting a string of large cluster infections following the end of Seollal, the country's Lunar New Year holidays.
지난 한 주간 발생한 확진자의 감염 경로를 보면 선행 확진자의 접촉이 32.4%, 집단 발생이 27.7%였습니다.
Regional authorities have set up rapidly deployable temporary screening centers to promptly identify positive cases and break the chain of infections. The Gurogu District Office in Seoul is now operating a test center at this large plaza outside a busy subway station. Tents have been set up, but where are the testing equipment?
안녕하세요. 여기 선별진료소가 있다고 들었는데.
네네네. 저기 오네요.
This truck is carrying walk-in screening booths, outfitted with all the required testing equipment. It's nearly identical to the fixed walk-in testing booths that were rolled out last year. But the biggest difference, and also its greatest advantage, lies in its mobility.
교회 단이라든지 아니면은 아파트 이런 형태로 밀집 지역에서 확진자가 많이 발생을 하는 것 같더라고요. 이제 구로보건소 이제 팀장님하고 찾아갈 수 있는 그런 선별진료소가 있는 게 도움이 될 수 있지 않을까 해서 저희가 개발을 하게 됐고요. 그 고정형 같은 경우에는 찾아와야 되죠. 찾아오는 도중에 확진자가 더 발생할 수 있는 이제 감염이 될 수 있는 그런 여지가 있었는데 다른 데 이제 확산되는 거 없이 찾아서 거기서 짧은 시간 내에 아마 감염이 발생할 수 있는 예상되는 그런 분들 대상으로 검사를 할 수 있기 때문에 훨씬 더 효과적으로 검사를 할 수 있다라는 것과
These truck-mounted testing equipment are also more resistant to inclement weather, like strong winds and precipitation, unlike conventional screening centers built out of tents. Screening centers made from shipping containers also offer good protection against nature and the elements, but assembling and disassembling them is a very time-consuming process. These truck-mounted testing equipment offer the best of both worlds, providing adequate protection against bad weather and ready to be deployed anywhere at a moment's notice.
마스크 좀 내려주세요. 네. 해보셔요.
So what's been the public reaction to this unique idea?
밖이랑 밀폐돼 있어가지고 뭐 눈이 오거나 비가 와도 아니면 바람이 엄청 세게 불어도 여기 바깥이랑 단절되기 때문에 온도 조절에도 좋고 복장 같은 경우에도 원래 바깥에 보면은 그 레벨D라는 좀 더 그 두꺼운 옷을 많이 입는데 만약에 트럭 안에 들어갈 때는 이렇게 조금 더 한결 가벼운 옷을 입을 수 있어가지고 업무상에도 더 편합니다.
트럭에서 이렇게 움직거리면서 그래도 코로나 검사하는 게 처음 보긴 했지만은 좋아요. 아이디어가 좋으신 것 같아요.
These road mobile screening centers are still in the pilot phase, but may see a much wider adoption in the future.
전국을 돌아다니면서 촬영을 하게 되는데 매주 원하는 지역으로 출동을 해서 대상 300분이면 300분 대상으로 검사를 하고 짧은 시간 동안 짧은 지역에 많은 이제 검사를 진행해야 될 경우 간단하게 출동해서 거기서 바로 검사를 이제 진행할 수가 있는 거죠. 효율이 굉장히 뛰어납니다.
Korea's COVID-19 testing solutions are continuing to evolve as it looks to take on the similarly evolving threat of new coronavirus variants.
(2월 26일) 국내에 처음으로 도착하는 코박스 화이자 백신 5만 8천 명분은 2월 27일부터 코로나 환자를 치료하는 치료병원 종사자 약 5만 5천 명에게 접종을 시작합니다. 영국이나 남아공, 브라질 변이 바이러스 이외에 일본이나 미국에서도 다양한 변이 바이러스가 보고되고 있어서 이러한 바이러스의 국내 유입 가능성도 있는 상황입니다.
We are poised to usher in a new chapter in our fight against the pandemic this coming Friday with the launch of our own inoculation campaign. And for more on this upcoming event, amid existing challenges, including the presence of variants, I have Professor Lee Sang from Yonsei University. Welcome back, Professor Lee.
Thank you for having me.
And joining our talk virtually is Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome, Dr. Kim.
Good afternoon.
Right, Professor Lee, then let's start with your assessment of Korea's COVID-19 situation.
So, Korea had been going through the so-called third wave since end of last year. And the case number has been decreasing somewhat, but in the earlier this year, the case number had been increasing last week up to 600 cases, and then it had to come down to 300 cases. So I think we are still we are going through the third wave, but I think the good thing is in much lower figure. But still, we are seeing quite a number of grouped, congregated outbreak happening in various places recently, also in major university hospital and nursery schools as well. So even though the number is in the 300 figures, I think we have to be still quite watchful for the situations.
Right. Right. And Professor, talking about the daily tally, where should the daily number of infections stand to ensure a productive vaccination campaign?
I think as for the vaccinations, which we are expecting to start on 27th of this week, I think if for the countries where they have a very high figure, they need to be introducing vaccine because the situation is bad and because there is a high number of the COVID-19 cases. But even though we have very low cases, still I think we need to proceed with this vaccination because the low number of figure in Korea that we are having, we are producing it at such a high cost for so many of the people closing down the business and enduring so much of the cost. So even though we are having this low number of the figures, I think maybe because there can be some of the congregated vaccinations process that can happen, maybe the lower the better, but still I think it is time that we have to just proceed with these vaccinations.
Right. Dr. Kim, the three variables to herd immunity, according to authorities, are inoculation rates, vaccine supplies, and coronavirus variants. And speaking about coronavirus variants, these variants reportedly reduce vaccine-induced antibody levels. What are your thoughts on this, Dr. Kim?
Well, actually, achieving a herd immunity, as you said, is based on the three assumptions. And one of the concerns that we have is that the variant, the viruses, and then the many actually vaccines are actually authorized for emergency use at the moment or under still just a development, actually show efficacy at least like a 60% or so just more than just 90%. And then this is the one of the assumptions that we are achieving herd immunity. But if the some variant issues arises, for example, like a South African issue, that actually, according to some earlier some preprint issues, that the vaccine efficacy could be less than the 50% against this variant. Although this test is based on only just the neutralizing antibody, they are not actually tested any cellular immunity things. But based on these numbers, this is quite just a concerning issues at the moment. And then the some variant. Well, we are actually talking about just variant viruses from the foreign countries. But there's also a possibility that the variant virus can arise domestically, although at the moment we do not just focus on those issues, but once we just start like a vaccination or some therapeutic interventions, there might be chances. And then the variant actually do not arise only in the foreign country. It can also just arise in the domestic territories as well.
Right, of course. Dr. Kim, there are also concerns about the emergence of more dangerous variants amid the high rates of infections within partially immunized populations. Now, this is according to a recent article by the Wall Street Journal. How do you respond to these concerns?
Well, it is just one of the common sense in the virology, because when we just talk about any antiviral drug, whether it is some chemical drug or like an antibody, if there's some pressure, pressure actually exerted by those things it's not really strong enough, then the virus somehow try to find a way to escape such kind of situation. So we have to actually just push the pressure, either just very strong or just none. So under some selective pressure, if it is very strong, then virus actually do not just adapt to such kind of the environment. So they actually just stop replication and then just disappear. But if the pressure is just modest, and then the virus is somehow just try to compensate such kind of the pressure by just changing, they are somehow just sacrificing by just reducing virus replication while just achieving some resistance to such kind of pressure, whether it is antibodies or whether it is any antiviral drugs. So we have to actually avoid such kind of thing. That also just occurs for other any antiviral, any antimicrobial, just the drug treatment as well. We have to keep the original regimen and then keep actually just treating the patient according to just original guideline.
Right. Meanwhile, back here in the country, Professor E, authorities claim inoculating 70% of the population will allow them firm control of COVID-19, even if its reproduction rate rises to above 2. What does this mean?
So this concept of reproduction rate or reproduction number, sometimes we call it R0 numbers, is that this just represents how much one person infects how many of the other persons. So if one person infects two people, then reproduction rate number is R value is 2. If it is 1, it means one person infects another one person. So what we are trying to do is as much as possible trying to keep the reproductive number down. If possible, less than 1 figure, which means if it is less than 1, then eventually as people spread the virus, it will kind of die down. But with vaccines, even though reproduction number is greater than 1, even though it becomes the value of the 2, as long as we have 70% of the populations vaccinated and be protected, which means even though this one person is infecting more than one person, 2 persons. In the case where we are having 70% of the vaccinations, then we are having quite enough number of people being protected already. So even though they are meeting with somebody who are COVID-19 patients, they would not be contracting the disease. So actually, vaccination actually caused the situation that, in a way, it kind of changes the reproduction number. So with enough vaccination, even though vaccine transmissibility is staying the same, but the people who are to be transmitted will be decreasing. So overall in the populations, we are seeing the protective effect. So that's why actually, and in terms of the vaccination rate, if we keep the vaccination rate above 70%, then even though the reproduction number is about the value of 2, we can still have the effect where we are having the reproduction number of about the value of 1. So that's why the country is actually trying to achieve the vaccination rate at least above 70%.
I see. Professor Lee, there is also much talk over the type of vaccine and the group that is poised to receive it as decided by authorities. What are your thoughts on this?
Well, there is a little bit tricky tricky situation because originally there had been discussed priority that had been discussed before to vaccinate the first responders first, healthcare workers, and then vaccinate people above 65 years old, and then other priority. But based on, but the situation is because even though we are having this Pfizer vaccine to be vaccinated first, and then we will slowly expand into using the AstraZeneca vaccines. But the issue was with AstraZeneca vaccines, the efficacy for the people above 65 years old, there had not been enough data to show the evidence for the strong efficacy, even though many of the experts think that eventually we will get the data and eventually there will be enough efficacy that will show into the data. But at the moment, we do not have the data. So in these situations, there had been a number of debates, even among the experts. But in these situations, the government decided that they would not proceed with vaccinating people above 65 years old because I think the notion is to vaccinate those people who will have protective effects, who have evidence-based ensured protective effects first. And then if we have enough data, then maybe proceed with vaccinating people above 65 years old. But another argument is that if we can vaccinate people between 20 to 50-year-old who are more active, and possibly these are the people who can spread the infection around. So maybe that might ensure that ensure the situation that where the possibility of infecting the people above 65 years old are less in the less dangerous situation. But there is still a little bit of debate because people who are in ages above 65-year-old, they are not getting vaccinated. So we have to be, those people who are in the long-term care facilities and elderly care home, they have to be a little bit careful in these situations.
Right. It's an ongoing debate right now. Dr. Kim, scientists outside of the country are developing second-generation vaccines against coronavirus variants. Tell us a bit about these efforts.
Well, the second generation that they talked about it's not really just completely new, just the concept. Just the people have just talked about those kind of the possibility for a long time already. And one of the strategies they are actually considering is they're targeting just multiple variants at the same time. It's like our just annual flu vaccination, where our annual flu vaccination actually targeting just like 3 different strains of influenza virus or 4 different strains of influenza virus. So it's like just maxing and just administering just 3 or 4 different kinds of strains of influenza virus, like the influenza virus at the time. So it's basically this is very similar to those kind of just concept. The second one is actually targeting the 2 different kind of viral protein. Most of the vaccine that are being just developed right now is targeting only just the viral surface glycoprotein, which is called the spike protein. Well, this is obviously just a very well-known target, and this is very immunogenic in terms of vaccination. But then people are also thinking about just targeting different type of just protein, in this case, a nucleocapsid protein. And this protein is inside of the virus particle, and this is actually includes just viral genomic just RNA. But the protein is also very abundantly expressed in the infected just the cells. So this might be a very just reasonable just a target for just a vaccination as well. And then the third one is actually just people trying to induce mucosal immunity. And the most vaccines that we are actually talking about right now is the main just the purpose is just preventing the COVID-19 disease, not the infection itself. But in this the third strategy is actually trying to block just the infection or just a transmission itself. So most of the vaccination actually induces our just some blood just neutralizing antibody, but that cannot actually just inhibit this virus infection itself. So to do that, we need somehow just immunize some upper respiratory tract. So this is the first just a site that when the virus actually infects our body. So by just inducing some sort of just a mucosal immunity, then the people actually think that maybe even just the transmission or just infection itself can be blocked by this type of approach. So these are the things that the people are just thinking about as a sort of just a second generation vaccine development.
I see. And Professor, keeping in mind what Dr. Kim has just said, what are some of the variables with regard to these second generation vaccine efforts, and how should Korea respond?
Well, I think this second generation vaccines are currently in the development phase. So I think what the government will try to do is try to focus on achieving the enough vaccination with this first generation vaccine for the time being. But I think as it has been discussed, there are a number of the variants that we are having some of the concerns. With some of the vaccines, maybe the efficacy can be compromised. So as actually the more and more variants appears, not only from the foreign countries, also it may possibly also occur from Korea as well. So I think while the government, for the time being, for now, focus on the first generation vaccine and achieving the 70% of the population coverage rate, But still, as the second generation vaccine is available, I think the government should be also ready, if it is available, to introduce in the timely manner.
I see. One final question, Dr. Kim. Very quickly speaking, researchers are looking into the possibility of mixing and matching the current vaccines that require 2 doses, Dr. Kim. What are your thoughts on this initiative?
Well, actually, this being actually talked about some the Sputnik, just a Russian vaccine, and then the AstraZeneca vaccine. But I think just the combination of 2 vaccines, technically there seems to be no, just a big problem, because 2 vaccines are very similar in terms of just the principle. The Sputnik, the V vaccine is actually just the combination of 2 different adenovirus vector vaccine. Actually, the first dose and the second dose, both of adenovirus, but 2 different kinds of adenoviruses. But AstraZeneca vaccine is another just adenovirus vaccine. So it's 3 different kind of adenoviruses, but somehow it can be just mixed well. It's not about just the RNA, just a mixing of RNA or adenovirus. It's just a mixing of a very similar kind of adenovirus vaccines. So I think it may just so available, and but I think it would be just probably await some trial of this combination, and it would just somehow relieve the some issue of just a vaccine, just a supply in the end.
Hopefully. Right.
Yeah.
All right, Dr. Kim, as always, thank you very much for your thoughts. And Professor Lee, thank you for being with us today.
Thank you.
Right, as Korea nears the launch of its inoculation campaign, pundits are calling for prompt and transparent disclosure of all related information to ensure greater public engagement in efforts to curb the pandemic. Thank you for watching. See you tomorrow.